Hey everyone, it's me again. It's been a while since I posted. Um, but as before I begin, as always, I want to thank my Lord and Savior Jesus Christ for another day of life. Thank you to my Lord and Savior. But since my H. pylori journey, since it's ended, I've, like I had this interest now. It's studying the GI tract system. But today, like I said, I wanted to talk about ulcers. You know, my previous video, but not my previous video, like a video I made a while back. Now I talked about my left-sided discomfort, and now, I thought it was like inflammation or something. I couldn't figure it out. Not even the doctors could figure it out. But now I strongly do believe, it was an ulcer. You know, um, ulcers, they can occur in the stomach. They can occur in your small intestines also. Now let's talk about what an ulcer is. An ulcer is an open wound. You know, gastric ulcers. Gastric ulcers is like it's an open wound in your stomach. Now just imagine, you fall down and you scrape your knee. It's an open wound. And say you put salt. Let's say you put salt or lemon juice on on that wound. It's gonna cause a lot of pain, lot of grief, a lot of discomfort. It's the same thing too. You know, as an ulcer. As a peptic ulcer. You know, um, also ulcers can be present in your stomach, on the top part of your stomach, mid part of your stomach, and the lower part of your stomach. And also, like I mentioned, they can occur in your small intestines. The first part, the first part of your intestines. You know, and but what are the symptoms? Symptoms sometimes everybody's different. Everybody's experience different symptoms. But to me, the main symptoms, getting full easy. Feeling that feeling of feeling full real easy. Um, Having pain around your belly button, discomfort. You know, and having pain or dull feeling or pain in your mid or your upper abdomen. And also too, people experience chest pain. Sometimes they're thinking they're having a heart attack. But it's when you have it also present, it's going to create chest pains. It's going to create chest discomfort. And also, people are going to experience acid reflux, gas, you know, dizziness, fatigue, and also ulcers that can bleed. You know, so some people will experience like a bloody taste in their mouth. Some people do vomit. And sometimes they'll vomit blood, and also too, their stools may look black or tarry. And that's due to having bleeding ulcers. Um, Also, let's talk about treatment. Ulcers not going to go away overnight. There's no magic pill. You know, it takes time. It could take 3 months, 6 months. But like I said, there's no quick way to heal from this. But treatment, like I always say, strongly suggest is getting an endoscopy to confirm that you have ulcers. Antacids. The one I suggest is like Carafate. Um, One, because it coats your stomach, it helps reduce the acids. You know, Another thing too is bland diet. That bland diet, like I said, it's key. It's part of treatment to heal on the healing process. You know, no seasonings, no seasonings, period, at all. You know, Another thing too, what helps is plain Greek yogurt because that helps coat your stomach. Not only that, it has lots of probiotics. And kefir milk also helps a lot. Because like I said, it coats your stomach. It has plenty of probiotics too. And I tried this a few times, and I did notice a difference. Was raw cabbage juice, And some people, it helps some people too, Another thing, at night, you're going you're going a long period of time without eating. And that's why I suggest too, I always tell people during the day is not go long periods of time without eating, because when your stomach's on empty, those acids are going to irritate your stomach even more and irritate those acids even more. But like I said, at night, you want to sleep with your head up. It's very important, And like I said too, also at night, you want to, if possible, try to snack. A little light snack, put something in your stomach, to create a barrier between those acids in that wound in your stomach, But, this is, like I said, I just want to talk about ulcers. Like I said, it's not easy, it's not easy dealing with it, But, also what causes ulcers too, is sometimes people do get them after H. pylori. People get them from consuming too much, say like ibuprofen, anti-inflammatory medications, But yeah, I hope this helps out, And like I said, I'm trying to get better equipment, to show, to show better stuff on my YouTube channel, But it's been a journey for me, financially. But I hope this helps out, and I hope everybody has a good night. And I'll be seeing y'all real soon.